Oh, please be seated. Prime Minister of Barbados, the Honorable Mia Motley, High Commissioner of Canada in Barbados, Her Excellency Marie Legault, Ministers of Education, Technological and Vocational Training, the Honorable Sansher Bradshaw, Minister of Labour and Social Partnership Relations, the Honorable Colin Jordan, Minister of Economic Affairs and Investment, the Honorable Marcia Cattle, Permanent Secretaries and Government Officials, Chair of the LesLois Shaw Foundation, Mrs. Virginia Shaw Hutchinson, and directors, representatives, and guests of the LesLois Shaw Foundation, Vice President of Major Gifts and Strategic Projects, the Sick Kids Foundation, Mr. Colin Henniger, and Manager of Major Gifts and Strategic Projects of the Sick Kids Foundation, Mr. Leonard Nolasco, Executive Chairman of the Queen Elizabeth Hospital, Mrs. Julia Vino Sutherland, and Executive Director of Medical Services, Mr. Anthony Harris, Executive Director, Nursing Services, Mr. Henderson Pinder, Executive Director, Human Resources, Mrs. Suzanne Reeves, and other representatives of the Queen Elizabeth Hospital, Chaplain of the Queen Elizabeth Hospital, Canon Noel Burke, Chief Medical Officer, Dr. Kenneth George, Chief Nursing Officer, Mrs. Sandra Barrow, Chief Public Health Nurse, Mrs. Estelita Tate, and other representatives of the health services, Deputy Dean of the Faculty of Medical Services, Dr. Michelle Lashley, and representatives of the University of the West Indies, Director of the Chronic Disease and Research Center, Dr. Simon Anderson, and representatives from CDRC, Chief of the Sick Kids Center for Global Health, Dr. Stanley Zlotkin, and Director, Capacity Building, Sick Kids Center for Global Health, Mr. Brian Smith, and members of the Global Child Health Team, Head Department of Pediatrics of the Queen Elizabeth Hospital, Dr. Angela Jennings, and fellow consultants of the Department of Pediatrics, specially invited guests, ladies and gentlemen. Good morning and welcome. I've only been allotted a very few minutes for remarks, and I fear that acknowledging you all has taken up the majority of the time. I hope that you all feel welcomed and appreciated, and that you will allow subsequent speakers to acknowledge you all in a much shorter version of the protocol. Thank you so much for being here, for the announcement of the next big step that we will take to provide the best possible care for our children. It's another beautiful day in Barbados, as you can all see, and happily, most of our children are well and well cared for. But it's not always been that way. We really don't know a lot about the care of the indigenous children of this land, apart from they had their skulls compressed by boards to give a strange-shaped head, which was thought to be desirable at that time. We do know that they did not survive subjugation and exposure to contagious European diseases. And even as Barbados, as a British colony, gained increasing economic importance, the health of the settlers and whatever children were born here was not good. In his True and Exact History of the Island of Barbados, published in 1657, Richard Lignan wrote on his arrival, "The living were hardly able to bury the dead." The health of children of subsequent waves of indentured servants or African slaves was hardly better. Any efforts to improve their physical condition was driven by the need to maximize their economic worth and not their well-being. Our climate did provide some health benefits, so much so as to inspire early medical tourism. In 1751, George Washington traveled to Barbados with his brother Lawrence, who was recovering from tuberculosis. But unfortunately, while here, George contracted smallpox, which was all too prevalent at the time. But thankfully, he recovered and moved on to greatness. In the 18 and 1900s, efforts by churches supplemented those by local government to provide some care for vulnerable children. A notable example was Dr. Charles Cave, no known relation, a Barbadian who initially trained as a nurse at the Seventh-day Adventist School in Michigan in 1900. A strong proponent of wellness living, he established the Hastings Hydropathic Sanitarium at Pavilion Court, which he actually operated for 15 years. To improve the health and well-being of women and children, Dr. Cave and his wife trained a cadre of largely Seventh-day Adventist women to be bedside nurses and to work to improve health in their community. He very early recognized that progress could not be achieved by physicians alone, but was heavily dependent on nursing and on good training. His first class of colored ladies to graduate as nurses were registered in 1931 as nurses and midwives here in Barbados. The last part of the 20th century and the early part of this century saw improvements and consolidation in what we offer our children, which is how we measure deaths of children 1 year and younger, was reduced by half from 26.9 per thousand to 14.2. And our newborn death rate, which is a sensitive indicator of health within a country and measures deaths in the first 28 days of life, was reduced by 2/3 from 24.2 per thousand live births in 1976 to 8.8 in 2016. A lot of this progress was brought about through strong leadership by Barbadians and an adopted Bajan who trained overseas and who returned to implement improved ways of caring for our children. Notably, Dr. Frank Ramsey was one of the first pediatricians at the Queen Elizabeth Hospital, and his work studying malnutrition is a seminal reference still today. The third generation of his cohort of malnourished children and controls, as well as their descendants, is still yielding valuable scientific information up until now. He is an honored public health champion of hero of Barbados, and he was the originator of our green card, which was an early foray into a child health record. Also, a main architect of and her work was instrumental in virtually eliminating maternal to child transmission of HIV in Barbados, among the first places in the world to show such a dramatic decline. She continues to be an advocate for our new epidemic of malnutrition, childhood obesity. And Dr. Richard Ishmael, who was the first pediatric cardiologist and who inspired the creation of our pediatric intensive care unit. In their footsteps we tread, to push boundaries and constraints to provide children in Barbados to access to the best available medical care, preferably here, but anywhere. The next steps involve both a program to develop the capacity and capability to be a center of pediatric excellence and an expanded home to house this improved quality care. Neither can be accomplished without help from our friends, which brings us to this morning. To invoke the blessings of our biggest friend, I would like to invite the chaplain of the Queen Elizabeth Hospital, Canon Noel Burke, to lead us in an opening prayer.
I invite us to bow our heads for a word of prayer. Let the little children come to me and do not stop them. For it is to such as these that the kingdom of God belongs. Let us pray. Everlasting God, we give you thanks for this day, for bringing us to this particular time. We give you thanks for the awe and wonder of creation, for the environment in which we are placed this morning. We pray for our nation, Barbados, the Governor General, the Prime Minister, all members of Cabinet, all members of Parliament, for the government and people of Canada, as we use every opportunity to create links and bonds for the good of humanity, for the High Commissioner to Canada here with us. We give you thanks, Almighty God, for the host of this event, the Honorable Mayor Motley, Prime Minister of Barbados, and for all involved. We pray for our premier health care institution, Queen Elizabeth Hospital, for the executive chairman, senior staff, and all members of staff. We pray for St. Kate's Foundation, for this collaborative partnership, benefiting the health of children, both in Barbados and across the Caribbean, between the government of Barbados and the people of Canada. Pray for the Queen Elizabeth Hospital, University of the West Indies, the LesLois Shaw Foundation, the Hospital for Sick Children, Toronto. Especially today, we pray for the children of the world, those affected by illness and disease. We pray for the good of those who use every opportunity to help them, for research and for human resource. It is our prayer today that this partnership may indeed redound for the good of all. O God, our Heavenly Father, you have blessed us and given us dominion over all the earth. Increase our reverence for the mystery of life and give us new insights into your purpose for the human race. Give us new wisdom. Give us determination in making provision for its future in accordance with your will. Bless our children. Bless this collaborative and transformational effort. And may your will be fulfilled for the good of all. This we ask in the name of Jesus Christ, our Lord. Amen.
Thank you, Canon Burke. It's now my pleasure to ask Her Excellency Marie Legault, High Commissioner of Canada in Barbados, to offer a few opening remarks.
Good morning, everybody. Please allow me to say that protocol has been established because I could never do it as well as our host, as our MC here. And I would be terrified of forgetting anybody. And I also know that there's a long list of speakers after me, so I will use the time as best as I can. Please allow me first to say thank you, Prime Minister, for allowing us to have this reception here on the beautiful grounds of Ilaro Court. Thank you. I'm honored to be here this morning as, not just as High Commissioner of Canada to Barbados and the Eastern Caribbean countries, but also as a Canadian and as a mother. As a Canadian, because I see here two very, very strong Canadian foundations joining forces here. The LesLois Shaw Foundation as well as the Sick Kids Foundation, two very strong Canadian entities who have joined forces to have an impact to Barbados. So I'm proud to be Canadian and have you here. I'm also proud to be here as a mother. I am also a mother, and as some of you know, my daughter had suffered injuries, life-threatening injuries last year. So I'm at the forefront knowing how important to have our children safe, and have access to good health care. As I said, a stay in a hospital for anybody is not a very fun experience when it's for ourselves. When it's for our parents or our partners, it's also very difficult. But when it's for our children, it brings the experience to a different level. So having access to exceptional medical professionals as well as a comfortable environment for our children helps reduce the anxiety that we feel and the difficulties and the stress that we feel at that time. So Canada is very proud for our well-known medical facilities and strong medical facilities. Let me take a couple of minutes because I know that we'll have a speaker from the Sick Kid Foundation, but I still want to brag a little bit about our institutions. The Hospital for Sick Kids, or Sick Kids, is recognized as one of the world's foremost pediatric healthcare institutions. It is Canada's top Canadian healthcare institution, and it proudly ranks fourth amongst all children's hospitals globally. So this is quite a feat. It was established 145 years ago by a group of Canadian women. Yes. They have been at the forefront of medical innovation for well over a century. Last year, the team that counts 13,000 staff, students, professionals, trainees, and volunteers oversaw over 78,000 emergency visits, 12,000 operations, and over 100,000 patient days. So this is quite a feat. Sick Kids is dedicated to advancing children's health by integrating patient care, the three parts of what is necessary: care, research, and education. It's more than a hospital, actually. It's a community uniquely dedicated to improving the lives of children. Sick Kids Foundation is one of the largest charity foundations in Canada, endowed with over $1 billion. Last year, or 2 years ago, it invested over $140 million in child health research, learning, and care. And I hope I'm not scooping you. Their vision is of healthier children, a better world. I think there's nothing that can say it more. Our children are our future, so we need that to have a better world. It's at the core of their work, and Canada is proud of the contribution to societies all over the world. I'm pleased to see how Barbados and the Caribbean are also benefiting from their work. In Canada, and we heard some statistics from our MC about healthcare, generally for children, or incidents for children, but specifically with cancer. In Canada, a child with cancer has 90% chances of surviving the disease. But here in the Caribbean, it goes down to 50% chance, which is 1 out of 2. And according to PAHO, the Pan American Health Organization, in Barbados, children have a 69% survival rate. If you're a parent of a child who has cancer, this is not a good ratio. This is not something you want to see. This inequality prompted the Sick Kids Caribbean Foundation, a not-for-profit focused exclusively on pediatric cancer and serious blood disorders across the Caribbean, to establish the Sick Kids Caribbean Initiative. It's a collaboration between the Sick Kids Center for Global Health and 7 Caribbean institutions across the region, in the Bahamas, Barbados, Jamaica, St. Lucia, St. Vincent, and the Grenadines, and Trinidad and Tobago. It was launched 7 years ago, and it since had already a lot of impact. A lot of over 400 case consultations have been facilitated, 200 diagnostic tests performed, 528 patients registered in local oncology databases. 27 Caribbean nurses have been trained in pediatric oncology, and I know that by the end of the program, there will be over 40. And 60,000 newborn sickle cell disease screening tests have been conducted in Jamaica and St. Lucia. That's quite a lot. The positive linkages between our countries, between Canada and the Caribbean, and here specifically in Barbados, between the Sick Kids Caribbean Initiative as well as with the LesLois Foundation, Shaw Foundation, are instrumental. It is those people-to-people ties, and I know that the Shaw family, and this is the chair here, have been involved in Barbados for many, many years. You're Barbadian Canadians. So this is just one other example of those linkages and those people-to-people ties that are so instrumental in bringing our people together and improving and bringing, the collaboration that we need on both sides. Talking quickly about the Queen Elizabeth Hospital, which is part of that collaboration. We know that it is the primary acute care medical facility in Barbados and a facility that is accredited internationally. It has existed for over 5 decades, and I'm very proud to say that 2 years ago, in 18, when it received the international accreditation at the gold level by Accreditation Canada, I was there at that event. So congratulations again for that achievement. So as I said, it is truly an example of partnership, collaboration, innovation, and relationship that brings Barbados and Canada together. And I know that the LesLois Shaw Foundation has been an integral part of that collaboration over the last 7 years, improving the lives of children in the region. We know that children who receive quality treatment in their local communities have greater recovery rate, which is why the work accomplished to date by the partners here in this room is essential in the fight against cancer. By working, as I said, by working with the University of West Indies, this is also a measure that will ensure the sustainability. And as I said, 27 nurses have been, pediatric oncologist nurses have been trained, and 14 more will be trained over the next few years. Children are our most precious resource, as I said before, and often the most vulnerable. Though in Canada, thankfully, childhood cancer accounts for less than 1% of all new cancer cases. The Caribbean region ranks 5th worldwide for cancer incidence and 4th for mortality in the world, which is quite high. In fact, Barbados, despite its small size, has the 28th highest standardized rate of cancer globally, and the 2nd highest age standardized cancer rate in the Caribbean after the Bahamas. We have seen an improvement, but as we see, there is still work to do to improve the lives of our children. We all need to put all those pieces of the puzzle. We need the children to have access to healthcare here in their environment, in their communities. We need to bring the other pieces of the puzzle in terms of research and innovation that Canada can bring. And let me just talk quickly about a friend who recently had his son had an undiagnosed, very challenging issue, very stressful. And through partnership between QEH, where the first investigation was done, and work with the sick kids where treatment was done and then can be brought back here as in terms of what can be done. Very proud to say that his son is on the recovery. Very happy to say that. So this is just a good example. Yes, please. And he is here with us today. So this is a real life example of the collaboration that can be done and all the pieces of the puzzle that we need to put together to make sure that our children have better access to medical care and better lives. So thank you, everybody. Thank you for being here. Thank you, Prime Minister, for hosting this, and thank you for my colleagues from Canada for all the work that you're doing here. Thank you.
Thank you, Excellency. It's now my pleasure to welcome the Honorable Miamor Motley, Prime Minister of Barbados, to address you. Prime Minister.
Thank you very much, Dr. Cave. Good morning, distinguished guests all. This morning, my task is perhaps the simplest task of all, simply to say thank you. And I do so conscious that I've had to, on recent occasions, say thank you as well. And it is a signal that our society has reached the point where we are managing better the combination of public resources with philanthropic resources in the interests of those most in need in this country. I don't think anyone in here needs to be reminded that the one cause that will always, always, always get support and move people is anything that can sustain the life of a child and to improve not just the length of the child's life, but the quality of the child's life. It is against that background that you didn't have to push a door with my government. It's a wide open space. And indeed, I've asked the National Cultural Foundation to be able to organize what I call some acoustic and heart-moving events on these grounds at the bottom that will go only in aid of being able to help the children of this nation, because we believe that even as we receive graciously, we need also to be able to do those philanthropic events that will allow ordinary Barbadians to play their part in wanting to sustain their own children in this country. Last night, the Bishop of the Anglican Church reminded us of that part of St. Paul's letter to the Corinthians. I believe it is chapter 9 where he invokes us to give cheerfully. And I come here this morning with that in the back of my head. But suffice it to say that my own government recognizes that we have a responsibility, even in difficult fiscal times, to step up to the plate. It is against that background that the government has taken a decision to be able to ensure that the Queen Elizabeth Hospital as a whole be the recipient of a $30 million loan to be able to re-equip critical aspects of the hospital's equipment infrastructure. The last such occasion being a decade or more ago. All of us will agree that in the area of healthcare, where technology evolves in the wink of an eye, and where the benefits from such technology make the difference between life and death, that we ought never to be in a similar situation where 10 years elapses again before we look at the equipment needs of our primary healthcare institution. So we therefore hope that we are not only giving them the opportunity to re-equip, but that we will be setting a different standard as to how we treat to the hospital's needs on an ongoing basis. I say so, conscious as well that we have already given them, and I hope that the hospital will start very shortly. Those are messages from the Lord. that He is with us. But I say so conscious that the hospital will very shortly start the expansion of the accident and emergency department, for which the government has already given them $10 million as well. Now, the Bible equally tells us that we are known by our actions and not simply by our words. And this government, in less than 2 years, without prejudice to what we have committed on to meet the recurring expenditure at full budget for the Queen Elizabeth Hospital, has also therefore found it possible to be able to allocate $40 million at a time when we do not have that fiscal space. And we do so because this is what matters to us, the health of the nation. There is one outstanding project that I am now about to approve, and we have committed the sum of $3 million before the end of this fiscal year, and that is the project that will, I believe I was in the well of Parliament last year when I committed the government of Barbados to being able to work with the Queen Elizabeth Hospital to reduce the mortality rate for what you doctors call what, MI? myocardial infarction. Is that the correct term? Which regrettably, for us in Barbados and the Caribbean, is at 37%, while in the developed world it is at 8%. This is an unacceptable figure, and we have therefore determined that in addition to us taking a presentation at the CARICOM Heads of Government meeting next week from the leading cardiologists of the region, that the government of Barbados will proceed to being able to make the difference by the expenditures that are necessary, from ambulances right back to adjustments within the accident and emergency department, that will allow us to be able to deal with patients facing these difficulties within the shortest possible period of time, which immediately increases their capacity to survive. To that extent, therefore, $3 million will be made available to the Queen Elizabeth Hospital as special project funds to get this project up and running. I refer to these projects as discrete projects because it is important that we begin to measure progress against what we invest. That is the only way we are going to turn the corner with respect to our forms of development, all forms, not just in healthcare. And to that extent, therefore, my government will continue to hold the hospital accountable for these three major projects that we are working with you on. My first exposure to this project was at the UN General Assembly in the margins at the Clinton Global Foundation last year, and we thank them for facilitating that meeting. They're not here with us, I don't believe, but we thank them as well for facilitating the meeting. I don't need to say welcome to the Shaws and LesLois Shaw Foundation and to the Hutchinsons, because you are Bajan, as you correctly said. And my engagement with you has not been in the context of healthcare, but as Bajans who want the best for this country. And on behalf of the children of this nation, I thank you for being that catalyst and working with us and the Sick Kids Foundation to make that meaningful difference in the lives of people, as our other trusts are doing in Barbados. I've gone public a few times by saying thank you to all of the major trusts, the Sandy Lane Trust, the Barbados Children's Trust, the Maria Holder Memorial Foundation, and I say to all of you, the LesLois Shaw Foundation, that this country could not easily have gotten through the last decade, which we refer to as the lost decade, without the philanthropic gifts that you have placed at our disposal. And believe you me, this country has noted it, the people have noted it. More importantly, the families whose lives you have improved are grateful to you for eternity. And we thank you for choosing to do it here, because we are conscious that you could have done it anywhere. And that, therefore, for us is special. I want also to say that it looks as though Monday is now Canada Day in February. Because this Monday, we have the opportunity to thank you as Canadians, and to thank the Sick Kids Foundation, and to thank the High Commissioner. And next Monday, I think we'll do the same thing with the Prime Minister of Canada, so when he is here with us. So we are conscious that we are building on relationships that go way beyond our lives. It is ironic that CIBC celebrates its 100th anniversary in Barbados this year. It is ironic that the other Canadian banks have also had, in one instance, longer and in one instance, shorter. Royal Bank, I believe, has been longer, and Scotiabank just shorter. But this goes to show you that the relationship between our countries is centuries long. And I'm happy to report that the temperature of that relationship is a good temperature. It is not in any means at risk of catching any kind of the unfortunate problems that are facing the world today. And we look forward to working with our Canadian partners, not just in the area of healthcare, or philanthropy, but in a number of other areas of development, particularly the climate crisis, which is bedeviling all of us at a rate and in a way that is really frightening sometimes. So my friends, I thank you from the bottom of my heart, from the bottom of the hearts of the people of this country. I simply note as I sit that this is a 7-year program. And I had cause on the 2nd of January on these grounds, at this premises, to be able to reach out to Barbadians and to set out what we believe to be the next mission of our country and of this government and any other, since it crosses electoral lines. And that is that we need for 7 years to put our heads down and to focus on making this country the best place to live, to work, to enjoy, to ensure that when our name is spoken of internationally, that people understand that Barbados stands for something and means something when it speaks, that is valued and principled, and that for Barbadians, that we have succeeded in making Barbadians want to live here above anywhere else in the world because they're comfortable, they're safe, they're healthy, they're empowered, and they're given opportunity. All of that is a lot of long talk to say one thing, that we become world class and that we become that place where people as a matter of choice want to be and want to associate with. And that doesn't happen overnight. So that the interesting coincidence of the 7-year time frame, which you believe to be necessary to establish the Shaw Center for Pediatric Excellence, is the same 7-year time frame that my government believes to be necessary to ensure that we become among the top tier of the global family of nations. Thank you and God bless.
Thank you, Prime Minister. I would now like to invite Colin Henniger, who is Vice President of Major Gifts from the Sick Kids Foundation, to say a few words.
Thank you, Prime Minister. Thank you, Ms. Legault. And thank you for hosting us today, Prime Minister, in these beautiful premises. The Honourable Selina Bradshaw, Minister of Education, Technological and Vocational Training and Leader of Government Business. The Honourable Colin Jordan, Minister of Labour and Social Partnership. The Honourable Marcia Cattle, Minister of the Ministry of Economic Affairs and Investment, and other officials of the Government of Barbados, welcome and thank you for coming today. On behalf of Sick Kids Foundation, it is an honour to be standing before you. You've heard today that Barbados and Sick Kids have long been partners with the goal of helping children and their families. Our two countries have also been partners in philanthropy, with the private sector stepping forward to ensure there is funding to help train medical leaders, care for the sickest children, and advocate for sustainable resources. Most recently, we saw this partnership in the first and second phases of the Sick Kids Caribbean Initiative, an 8-year capacity building project to improve the diagnosis, treatment, and care for children in 6 Caribbean countries who suffer from cancer and serious blood disorders. This was initiated by Dr. Victor Blanchette, a name familiar to many of you as Sick Kids' former Chief of Cancer and Blood Disorders and who calls Barbados his home. Dr. Blanchette's title as Medical Director is evidence of one of the original donors from the family whose son was diagnosed and treated by him at Sick Kids over 10 years ago. The McCaig family, a Canadian family who also call Barbados their home, funded the original feasibility study and further supported the initiative, recognizing Dr. Blanchette's title as the McCaig-McGee Family Medical Director. Others from across Canada and the Caribbean also stepped forward, and we are now seeing the results of your generosity in the improved access to specialty care and treatment for children with cancer across the region. Your support is already making a difference for those children and their families. Many of you are in the room today. From the LesLois Shaw Foundation, Virginia Shaw Hutchison, Les Hutchison, Laura Buckley, Kim Housen. From CIBC First Caribbean, Mark St. Hill, Deborah King, Clenau Goodman, and Linda Goodridge. From Scotiabank, Kim Stanton. Republic Bank Barbados, Anthony Clerk and Sheriff Zephyrin. Derek and Gay Smith and our friend Pip Chalice. Sandoz Foundation, represented by Ramel Sobrino and David Hines. Sagicor, Ed Clark and Susan Boya. Amera Caribbean, Peter Williams, and Solange Payne, Slidell Bank and Trust, represented by Riley Weeks, Debbie and William Tomlin, and the Blanchette family. Please join in thanking these amazing partners for what they have accomplished to date. Transformational gifts like the one we will announce today require a transformational vision, but they also require a trust between partners and a mutual goal. At Sick Kids, we have been the beneficiaries of generous transformational donations, 3 of which funded centers: the Guerin Family Cancer Center, a name familiar here in Barbados, the Labatt Family Heart Center, and the Ted Rogers Center for Heart Research. These types of donations bring together disparate teams from across Sick Kids, from across Toronto's healthcare system, and children from across Canada and the world to enable faster research, clinical trials, and healthier outcomes. I was first introduced to the LesLois Shaw Foundation 10 years ago, in 2010, my first year working at Sick Kids Foundation, when the directors made a generous gift to the highest priority needs of the hospital. With the launch of the Sick Kids Caribbean Initiative, they again stepped forward in 2012 to become the lead donor for Barbados. 3 years ago, Director Michelle Pratt approached Dr. Blanchette and I, asking what kind of partnership would create a transformational impact for child health in Barbados and the Eastern Caribbean. With the support of the LesLois Shaw Foundation, Sick Kids conducted a feasibility study, engaging many of you in this room, from Queen Elizabeth Hospital, the University of the West Indies, the Ministries of Health and Wellness and Education, Technological and Vocational Training, the Chronic Disease Research Center, and the Barbados Community College to understand whether Sick Kids is the right partner. Indeed, we believe we are. And the vision you will soon hear is transformational, and the gift that will make it possible is transformational. Today, we announce a vision to improve the lives of children and their families across Barbados and the Eastern Caribbean so that they have better chances of living healthy and happy lives. Please join me now in welcoming Chair of the LesLois Shaw Foundation, Virginia Shaw Hutchison, to the podium to make this special announcement.
Good morning. Prime Minister Motley, Canadian High Commissioner Marie Legault, and special speakers and guests here gathered. I think the High Commissioner said this, and I think all Canadians said this, so I'll just join the Canadians, but mine is written down. And that is a very special thank you for hosting us in your home, and very gracious to be here. And I think very appropriate, a child-centered environment for us to be here. Thank you. I am honored to be here on behalf of my family and the LesLois Shaw Foundation. As the chair, I would also like to recognize, well, I think they were recognized. So when you end up being third in line or fourth in line, I'm good at just going off script, so if you'll bear with me, they have been recognized, but I just want to take another special recognition, is that I do have company here, and it's great to have them fly in from Toronto and be here with us. And that is 2 foundation members that are here with me today. And I have Les Hutchison, he's a founding member of the foundation, and Laura Buckley from Toronto, director of the foundation, both of whom are great champions of improving global health. My mother, who is nearly 89, March 31st, 1931, won't forget, is also a director. She lives in Barbados and could not be here today, but sends her very best wishes. Our foundation is predicated on Shaw family values. We have an entrepreneurial spirit and courageous in our philanthropic work, and firmly committed to good stewardship and support bold ideas, and especially the people dedicated to achieving and making this world a better world. Over the last decade, the LesLois Shaw Family Foundation has supported 65 charitable partners in 18 countries, supporting over 1 million individuals to improve the human condition. Our work here in Barbados has been especially filling. My mom and my father, Les and Lois Shaw, moved from Canada in the 1990s, and built some wonderful friendships and bonds in Barbados. And over the many decades, my family established businesses, employed Bajans, enjoyed the sun and had a little fun. And my parents were and are truly blessed to be living here in Barbados. I thank you for your warm welcome to them. Many of you have given and extended to my parents over the many decades, and to my husband and myself here in Barbados. As part of the community in Barbados, we sought to give back. We sought to look for opportunities to make an impact, to hopefully make a change or a difference in families here. It is our faith that leads us to act. We looked for partners who shared common values, and we didn't have to look too far from home, Canadian home, sick kids. I think Colin stole some of my words here about when we were working together years ago, a decade ago, where we made our first donation to the hospital itself in Toronto. And that was for high priority needs in the hospital there. We expanded that relationship, as was said, to become the lead donor of the Sick Kids Caribbean Pediatric Cancer and Serious Blood Disorders Initiative. And in 2013, we celebrated the opening of the Shaw Family Telemedicine Room here in Barbados, where we saw over 50 consultations take place, enabling children to receive the best quality of care at home. We've seen Dr. Chanel Brown trained at Sick Kids and now at Queen Elizabeth Hospital practicing as a pediatric oncologist. Also, we've seen nurses complete specific trainings with Sick Kids in children's cancer, blood disorders at the University of the West Indies. All the while trying to establish a holistic culture of care of patients and their family. We are thrilled to see the philanthropic communities of both Canada and Caribbean come together for a common purpose, to better diagnose, treat, and care for our children. Allow me to share with you a quote from Michelle Obama, former First Lady of the United States, who often inspires me. When I think about the country I want to give my children, it's not the world we have now. All I have to do is to look into the faces of my children, and I realize how much work there is to do. When we were looking to continue our work, our investment in the children of Barbados and Eastern Caribbean, you welcome Sick Kids to once again partner in something that's very, very important to us. On behalf of the entire family and the LesLois Shaw family, I thank you for bringing our vision to life here in Barbados. Barbados has the foundational elements all in place through a strong long-term relationship with the Prime Minister, Barbados Ministry of Health, Sick Kids, Queen Elizabeth Hospital, the University of the West Indies, the LesLois Shaw Foundation, and the Clinton Foundation. We are happy to announce a Pediatric Center of Excellence here in Barbados that will be established over the next 7 years. It is our hope to create a modern environment for patient and family, while aspiring to establish a center of innovation for pediatric research, education, and care. I can't wait to see what the future holds for the people of Barbados. I know it will be incredible. I believe this incredible partnership will have a lasting impact. We believe every child deserves a fighting chance to a healthy life. Now, please join me in the unveiling of the official announcement of the Shaw Center for Pediatric Excellence. Thank you.
Thank you very much. I'm sure you must be all interested in hearing exactly what this plan is that we have been alluding to for nearly an hour now. And to explain is the Vice President, Capacity Building from the Sick Kids Global Child Health Center, Brian Smith. Brian.
Good morning, ladies and gentlemen, fellow presenters, Prime Minister Motley. So included in today's program, you would have received, it's the infographic that's been created. And it provides an overview of the 7-year Sustainable Capacity Building Program that aims to improve the lives of children and their families in Barbados and the Eastern Caribbean. So the goals of the Shaw Center for Pediatric Excellence are to, first, establish a critical mass of health workers with expertise in pediatrics and maximize the quality of the environments in which they work. Second, to leverage this new skilled health workforce to improve the quality of pediatric care and establish a culture of continuous improvement. And finally, to invest in research and advocacy that informs policy and drives sustainability. The Shaw Center for Pediatric Excellence will achieve these 3 goals and have tangible, lasting impact through 4 work streams that are synergistic and build upon each other. These include excellence and innovation in pediatric education, the patient and family experience and clinical environment, excellence and innovation in pediatric care, and finally, pediatric research and innovation. So to achieve excellence and innovation in pediatric education, the program will develop a specialist nursing program here on the island of Barbados in pediatrics that will train an initial 40 pediatric nurses to support the Queen Elizabeth Hospital and the island's polyclinics. It'll then look at training 4 physicians in targeted high-need pediatric subspecialties through fellowships at the Hospital for Sick Children. Finally, there will be support for 6 international observerships, specifically in quality improvement, that twin their experience at the Hospital for Sick Children with healthcare settings in Barbados, either at the Queen Elizabeth Hospital or one of the island's polyclinics. To improve the patient and family experience and clinical environment, the program will refurbish the Queen Elizabeth Hospital pediatric ward, specifically looking at procuring necessary medical equipment and installing furniture in the wards and waiting rooms to improve the family experience. It'll also look at refurbishing the island's 8 polyclinics child health spaces and procuring necessary medical equipment and really focusing on the family experience. Leveraging the new skilled health workforce and improved clinical areas, excellence and innovation in pediatric care will be established through the implementation of 8 high-priority clinical quality improvement initiatives. It'll also focus outside of the island by implementing a patient amenity fund, specifically to support families from the Eastern Caribbean to access care at the Queen Elizabeth Hospital. To support sustainability, the program will invest in Barbados-focused pediatric research and innovation by supporting 3 Catalyst grants that will look specifically at pediatric challenges or problems, and support 2 local postdoctoral fellowships that are looking, again, specifically at Barbados-relevant pediatric issues. Finally, the program will use as a foundation for a lot of the research that will occur, work with the Chronic Disease Research Center and researchers at the University of the West Indies and the Ministry of Health to complete a national childhood obesity surveillance project. A center of excellence is established when there is a critical mass of expertise and activity in place around a particular area of focus that enables strong and sustainable leadership. At the end of 7 years, I am confident that with the generous support provided and the passion and dedicated support of the Barbados medical and education communities, we will have established the Shaw Center of Pediatric Excellence and improve the lives of countless children and their families in Barbados and the Eastern Caribbean. Thank you very much.
Thank you, Brian. I would like now to invite Mrs. Juliet Bino Sutherland, the Executive Chairman of the Queen Elizabeth Hospital, to explain how this will fit in with the operations there.
Thank you so much. Normally at this stage you would say protocol being so beautifully established earlier, but allow me for a moment just to actually go back to the traditional way, because so many persons here have been instrumental to where we've reached today. So it is important that I clearly recognize the Honorable Prime Minister for her continued contribution and direct engagement with us here at the hospital. Marie Legault, thank you. Accreditation Canada is an important partner in how we do business at the hospital and how we establish quality standards. Colin Hennigar, we've spoken on the phone and we've met in person. Thank you very much. Acknowledging you. Fellow directors Brian Smith and Stanley Zolkin. About to meet you, Virginia Shaw. Hutchinson, chair of the LesLois Foundation. Other visiting directors who joined us. And Dr. Jennings Cave, QEH Permanent Secretary, PSCMO, and I see our partner ministries who work so closely with us at the Queen Elizabeth Hospital, represented by Ministers Bradshaw, Cattle, Jordan, and Ford, here with us this morning. Thank you very much. It is my honor to address you this morning at the official launch of the Sick Kids Initiative to create a pediatric center of excellence at the Queen Elizabeth Hospital. This initiative is now duly recognized as the Shaw Center for Pediatric Excellence. It is our vision at the Queen Elizabeth Hospital to be the premier provider of tertiary health care, an exemplar of good corporate governance, and the employer of first choice in Barbados. Through the assistance of the LesLois Shaw Family Foundation, Sick Kids Canada, Sick Kids Foundation, and the establishment of this Center of Excellence, we are one step further towards the manifestation of this vision, as this vision captures all elements of our aspiration. The desire to be clinically strong, to have a focus on quality, the desire to ensure that our staff are given opportunities to train and have good capacity development, and importantly, the importance of having teaching and quality built fundamentally into our processes at the hospital. The objective of the Shaw Center for Pediatric Excellence expands the current services and capacity of the pediatric department to address present and future medical needs of Barbados and the region's children over the course of not just 7 years, but we're projecting 50 years. Research undertaken by the Sick Kids Foundation has shown that a pediatric center of excellence at QEH will positively impact the health and well-being of not just children in Barbados, but across the region, ensuring here locally that there are strong linkages to pediatric care through the country's polyclinic system and through research activities and teaching at the University of the West Indies. It is our vision to fundamentally transform the way we deliver care and services at the hospital. And this initiative will take us significantly in that direction. We recognize the state and taxpayers cannot do this work alone. Therefore, philanthropy and gifts of this nature are fundamental to our ability to achieve this transformative vision. This Center of Excellence model allows the Queen Elizabeth Hospital to grow and develop through partnerships. And as such, the administration of the hospital will be given special focus, nurturing. Dr. Cave and Dr. Jennings can tell you just about all of the needs that they have identified to us. We've been working assiduously
to address, and that is how I know Colin and others so well and so beautifully. We also intend for this Center of Excellence to provide us opportunity to have lessons learned, because others in the hospital are beginning to recognize that this model of global partnerships is an important way that we can build out the services at the hospital, and other departments in the hospital are developing similar interest in having such centers evolve across the hospital. We're also, because of your investment here as a foundation and the Sick Kids, attracting other donors who are interested in partnering with us to build out the infrastructure needs of this project. And we are very much looking forward to those who are interested in coming on board to really help to build out the existing areas that are in need of support. Over time, we see this partnership assisting us to reduce the need for sending children overseas as we're able to translate some of the expertise that now exists in that Center of Excellence Sick Kids here in Barbados with the existing specialist expertise that we have here. I cannot close without recognizing the importance of leadership. Leadership is everything at the hospital, and this leadership has been brought by Dr. Angela Jennings of the Pediatric Department and Dr. Clive Cave, who not only do a fantastic job of caring clinically for the children, but also dedicate a significant amount of their time to teaching, and in this instance, to ensuring that this proposal initiative receives all of the necessary driving and support that is. I think we should pause for a moment and recognize the contribution of the Department of Pediatrics. Indeed, other departments in the hospital are often very jealous because we say that the pediatrics department is certainly one of the best departments and really out front in a number of areas and to be emulated. So therefore, on behalf of the Minister of Health, the Ministry of Health, the board and management of staff of the hospital and the Department of Pediatrics, I wish to extend sincere thanks to the LesLois Family Foundations, Sick Kids Canada, Sick Kids Foundation, to this very welcomed investment in development of pediatric services at the Queen Elizabeth Hospital, and the benefit it will derive to the people of Barbados and the citizens of our region. This partnership will go a significant way towards helping us achieve this vision that we're so carefully crafting in partnership with the Prime Minister and Government of Barbados. Thank you.
Thank you, Chairman. I'm sure Dr. Jennings needs a moment to recover from the praise. So we'll invite our other essential partner in education, the University of the West Indies, because what we do is a combination of teaching and education as well as clinical service. Dr. Michelle Lashley is Deputy Dean Clinical for the Faculty of Medical Sciences at the University of the West Indies, Cave Hill. She's stationed at the Queen Elizabeth Hospital and a consultant in our department. Michelle?
Good morning. Just to acknowledge again Honorable Mia Motley, Prime Minister, and certainly Ms. Marie Legault, Canadian High Commissioner, and our ministers. But I won't delay too long with the protocol. I know we are already delayed and sort of in our time frame. But this morning, on behalf of the University of the West Indies, and specifically the Faculty of Medical Sciences, I really want to thank the LesLois Shaw Foundation for their generous support for this inaugural partnership. This is a partnership, obviously, not only with the hospital, but essentially with the government of Barbados and as well with the University of the West Indies. And we are here, as you heard, to establish a center of pediatric excellence here in Barbados. As the University of the West Indies team, we are pleased to partner with this group specifically in the areas of education, research, and I think I added this at the end because what we haven't really talked about is sustainability. And with that, we expect to sustain this for the future. Medical teaching of the University of the West Indies at Cave Hill was established as far back as 1968. Some of you may have heard of the Eastern Caribbean Medical Scheme, And this was initially an offshoot of Nimona campus. Over the years, we have continued to establish ourselves in this community, and we have become a fully independent and resourceful faculty, becoming a full faculty since 2008. The faculty is fully accredited and has provided the medical education of medical personnel, both here in Barbados, in clinical areas and administrative levels over the years. And several of the physicians here in the latter rows of this meeting are all graduates of University of the West Indies, either the undergraduate and or the postgraduate level. The vision of University of the West Indies as an excellent global university rooted here in the Caribbean has been proven and ratified by our presence at all levels of healthcare facility, both locally, internationally, and at the governmental levels. And many ministers of health throughout the Caribbean are also University of West Indies graduates. And you've also already heard of our involvement with the SCI program here before. The faculty has a well-established postgraduate medical training program, not only in child health, but across several disciplines, as well as postgraduate training in public health and in nursing. And this new partnership will fund the training, as you heard, of highly needed pediatric subspecialty physicians, as well as the most particularly needed pediatric nurse specialists. And these persons are required to create this critical mass of healthcare workers to deliver the quality of pediatric care we envisage for this future. The training resulting from this investment in the next generation of healthcare professionals will enhance the delivery of care not only for the children of Barbados, but has the potential to be a positive transformation and beacon of excellence in the landscape of child health throughout the wider Caribbean. The research emanating in the Faculty of Medical Sciences has already been used to guide policies and interventions that influence health. Our premier research arm, the George Allen Chronic Disease Research Center, as known as the GACDRC, is a unit of the Caribbean Institute for Health Research of the University of the West Indies. The GACDRC is committed to producing the data-driven evidence to support population-level improvements, both in health and reductions in health and healthcare inequalities. And the center already has an excellent track record in conducting these surveillance projects in the adult world. And so this new partnership will contribute to child health-related surveillance and research activities, particularly in the topical areas of childhood obesity research. The university's overarching policy is to revitalize and sustain Caribbean development through education and policy. And it's with this vision, the partnership with the foundation through the Hospital of Sick Children positively aligns with the university. We call it the AAA Strategic Plan. This is a 7-year plan, like most things are all in the 7-year issue, and what started for us in 2017. The theme is access, alignment, and agility. And this partnership fits perfectly in the areas, because in the areas of access, we expect to be the university for all, as we are all already. To alignment, to increasing and improving academic, industry, and research partnerships. This fits right into that little slot. And agility, establishing the physical presence of the University of West Indies throughout the world. So I'm confident that this investment in Barbados as a sector of pediatric excellence will have a significant impact on the health and wellness of the children of this nation. And in addition, we'll be able to establish the pediatric community and our educators as role models for the whole Caribbean in the areas of pediatric care, research, education, and innovation. Thank you very much.
Thank you, Michelle. Dr. Angela Jennings is a general pediatrician, well known for her care offered on an individual level to patients in Barbados, but she's also head of the Department of Pediatrics at the Queen Elizabeth Hospital. Dr. Jennings?
Good morning. The Honorable Mayor Moore Motley, Prime Minister of Barbados, Her Excellency Marie Legault, the Canadian High Commissioner to Barbados, ministers and ministry representatives, members of the LesLois Foundation, the Sick Kids Foundation, and the Center for Global Health, Child Health, Sick Kids, colleagues, distinguished guests, ladies and gentlemen, good morning. On behalf of the Department of Pediatrics, I would like to take this opportunity to thank the LesLois Foundation, the Clinton Foundation, the Sick Kids Foundation for their support and partnership with the Government of Barbados for the creation of the Shaw Center for Pediatric Excellence. It is an honor to provide insight into the current pediatric landscape and the significance of this investment. Over the past 25 years, there's been a great shift in the pediatric illness landscape in Barbados. Historically, illnesses seen included malnutrition, gastroenteritis, and other infectious diseases. Presently, non-communicable diseases, for example, asthma, type 1 diabetes, childhood cancers, and obesity predominate. Primary pediatric care is offered at the 9 government polyclinics, private pediatricians, and general practitioners' offices. Secondary and tertiary care is provided at the Queen Elizabeth Hospital. At the polyclinics, there are over 24,000 child health visits each year. There's a robust immunization program with greater than 95% national coverage. Other services include vision and dental screening and nutritional support. The Sir Albert Cecil Graham Development Center caters to children with special needs. Over 150 new patients are seen annually. Here, children receive developmental evaluation, occupational, speech, and physical therapy. The pediatric department of the Queen Elizabeth Hospital comprises both an inpatient unit and an outpatient clinic. The inpatient unit comprises the general pediatric ward, for which there are 45 beds, the pediatric intensive care unit, which has 4 beds, and the neonatal intensive care unit, which has about 25 beds. There are over 1,500 admissions to the general pediatric ward each year, and over 150 to the pediatric intensive care unit. The illness profile includes respiratory illnesses, diabetes, epilepsy, and childhood cancers. On the neonatal intensive care unit, there are over 400 admissions each year, which is approximately 20% of our live births. And here, the illness profile includes premature infants and sick-term infants. Pediatric hospital care is provided by a team of consultants, residents, and general nurses. In addition to the 3 general pediatricians, 2 neonatologists, and 1 intensivist, and an interventional cardiologist and a pediatric hematologist oncologist, Dr. Chantal Brown-Farmer, were recently added. And Dr. Brown-Farmer is a product of the Sick Kids Caribbean Initiative. In the outpatient clinic, there are over 5,000 child visits each year, and specialized care is offered in the areas of general pediatrics, cardiology, asthma, suspected child abuse and neglect, neonatology, hematology, oncology, and psychology. Over the years, the pediatric landscape has had significant partnerships, and at the hospital, we've benefited significantly from partnerships with the private sector for pediatric training and the acquisition of critical equipment to ensure the continued delivery of high-quality care. We have been fortunate to partner with Sick Kids Caribbean Initiative, and as I said before, this has resulted in the training of a pediatric hematologist oncologist and 3 pediatric hematology oncology nurses. There's currently 1 nurse in training. At a national level, there is a newborn hearing screening program and the establishment of a cochlear implant program through a partnership with the Sir Albert Graham Development Center, the Sandy Lane Charitable Trust, and the otolaryngology department of the hospital. The World Pediatric Project provides access to specialized care for children with orthopedic, cardiac, and surgical needs. And the Heart and Stroke Foundation has partnered with the department on a campaign to curb childhood obesity. Now, what does this Shaw Center for Pediatric Excellence mean? This human resource investment is monumental and will allow capacity building through education. In this form, it's hard for me to show you my excitement, but I've been mentally doing cartwheels around this room all morning. This means that our ability to deliver high-quality care to our patients will improve, and a wider range of pediatric conditions will be treated locally. This aligns with our pediatric core belief of providing excellent care for each child through teamwork, education, and advocacy. We are working, but there is more work to be done, and help is needed. Over the next 7 years, there will be, as Brian would have outlined, training of specialist pediatric nurses to provide care across the Barbadian health system, training of doctors in specified subspecialty areas of pediatrics to build capacity and also for succession planning. There'll be partnership with the Sick Kids Hospital to develop local quality improvement measures and research initiatives to ensure improved outcomes for patients with chronic diseases, for example, asthma and obesity. And as we said, this is really a human resource component, but there is a small infrastructural component, which will be the acquisition of some needed medical equipment, as well as the creation of child-friendly spaces at hospital and the polyclinics. As we stand and look to the horizon, the future of pediatric care in Barbados looks bright. For the next 20 years and beyond, the Shaw Center for Pediatric Excellence will have a sustainable impact on the health and well-being of children in Barbados. In addition, these services will be offered to the children of the wider Caribbean community. On behalf of the pediatric team across the island and the children of this country, I thank you.
Thank you, Dr. Jennings. It's now a pleasure to introduce Dr. Stanley Zotkin. At this occasion, not to give me a grade, as he would have had to do while I was a resident at Sick Kids a long time ago, but to speak to you as Chief of the Center for Global Child Health from Sick Kids.
Thank you, Clyde. Good morning, distinguished guests, colleagues, and friends. Thank you to the Honorable Mia Motley for welcoming us to your beautiful residence in Barbados, and to the Sick Kids Foundation for hosting this momentous event. And of course, I'd like to take this time to acknowledge and thank Virginia Shaw Hutchison and the LesLois Shaw Foundation, whose generous donation will indeed have a long-lasting effect on the health and well-being of children and their families in Barbados and the Eastern Caribbean. As you can imagine, being the last speaker, everything that is in my notes has been said. So I'm going to, with your permission, go off script, and I will be very short. I would like to suggest that the Prime Minister really challenged all of us to be successful in this program. And I'd like to give you 3 reasons why we're going to be successful, very short reasons. First reason is that Sick Kids has the support of the board and senior management. The vision, as you've heard before, is healthier children, a better world. In their wisdom, they could have said healthier children, a better Toronto. They could have said healthier children, a better Canada, but they decided healthier children, a better world. So with the support of the board and senior management, we have full support of our institution to make this a successful program. Reason number 1. Reason number 2 is, we've talked about this before, sustainability. We have programs in sub-Saharan Africa, in the Far East, and in the Caribbean, and in every program, the word we start off from the very beginning is the word sustainability. We do not want to come, drop in, and do something for a short period of time. We want to make sure that whatever we do is sustainable, not only for 7 years, but even longer. So the second reason we're going to be successful is sustainability. And the third is we will be accountable. Throughout this program, we have built in evaluations on a regular basis so that when we come back to you, Madam Prime Minister, and you say, how is this program going? Through our evaluations, we're going to be able to tell you exactly how this program is going. So we will be accountable. So the 3 measures are, we have the senior management behind this program, we have sustainability built in, and we will be accountable for what we're doing. I'd like to end by simply saying once again, thank you to Virginia Shaw Hutchison and to the LesLois Foundation, to Sick Kids Foundation, and to all of our partners and donors whose generous contributions will help us realize our shared vision of healthier children, a better world. Thank you very much.
Thank you all very much. Thank you very much for being here. And before you leave, please, we'd like to offer you some refreshment and drinks. The bar is at the back, and some food will be provided for you. Ladies and gentlemen, thank you very much. We look forward to giving you progress reports as we certainly look to improve the health of children here in Barbados. Thank you very much. Before you all leave, I've been asked to invite the official party just to have a group photo at the front for the press. Here, in front.
Yeah, let's just say that was here.